Hello and welcome. It's 11 a.m. here in Seoul. I'm Choi Jung-yoon at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the COVID-19 outbreak. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. Yoon Tae-ho, the overall officer of disinfection at the Central Disaster Management Headquarters, will be briefing us on the coronavirus situation here in the country. He will fill us in on the number of new infections as of midnight and the efforts that the government is making to contain the virus. To give you a brief idea on the COVID-19 situation, South Korea reported 444 new cases of COVID-19 on Wednesday, climbing back above the 400 mark of the first time in 4 days. Let's take a listen.
First of all, we have Mr. Yoon Tae-ho with the explanation on the COVID-19 response. Let us now begin our regular briefing for March 3rd, Wednesday. As of today midnight, we have a total of 426 new local infections and 18 new imported cases. Yesterday, we had 6 additional fatalities, and I extend my deepest condolences to the deceased and the members of the bereaved families. First of all, here are our updates on the hospital capacity response, and we have 558 beds available for intensive units. And also for light symptom patients, we also have about 11,000 beds available, and we have 0 patients who are waiting to be admitted to hospitals. And here are our quarantine responses as well. Yesterday, we had carried out about 67,000 tests for those with suspected symptoms. And at the testing centers, we carried out about 34,000 tests, while at the makeshift testing centers in the metropolitan area, we carried out about 30,000 tests. In particular, we set up a special screening centers, especially 17 screening centers targeted for the migrant workers. And in the Dongjucheon city area, we identified over 100 migrant workers who have been tested positive for the virus. We would like to ask and encourage all of the migrant workers to get tested as soon as possible. And remember that you would not face any discrimination or disadvantages upon getting tested. And as for the workplaces that employ the migrant workers, here are some updates on our quarantine measures. Due to language barrier, it is difficult for these migrant workers to be fully acknowledgeable of these protocols, especially in terms of quarantine. And also the quality of their living is also quite relatively low, and therefore it is really important for the managers and the employers of these migrant workers to encourage them to also get tested. And starting from November until now, we have carried out about 130,000 offices and workplaces, and we have looked at a special inspection for about 10 manufacturing and about 500 manufacturing sites, as well as those manufacturing sites related to agriculture. And we are carrying out continued on-site inspection, and we are looking at small and medium facilities that employ over 50 migrant workers, and we are also looking at about 11,000 facilities nationwide. And we will have also regional offices and regional public servants who will be supervising such an pan-government inspection, and we will make sure that any facilities that breach these measures will be faced with penalties and fines. And also, as for the high-risk workplaces, we are also going to collect some environmental samples so that we can see whether these places are prone to virus infections. Aside from our current efforts, we will also look into the migrant workers and the employers, and we will give them text messages, and we will also let the let these campaigns to be also known through the support centers for migrant workers nationwide. And also during the rest of the week, we will also inspect the industrial complexes, and when we do so, we will also look into areas that are prone to these COVID-19 infections. And we also have some updates on the non-accredited educational facilities. And you must remember the IM mission group's educational facilities that have been prone to a large cluster infection. And to this end, the Education Ministry, as well as provincial education offices and the police agency, we are looking at the updates and the status of these non-accredited educational facilities. And we have looked into about 530 facilities nationwide. And out of them, we had identified about 98 of them which ran dormitories for their students. And we also carried out mandatory massive testing, and out of them 74 facilities have completed the testings, and the rest will also follow suit. And in order to reach and herd immunity, and also in order to curb the further spread of the virus, the government is exerting its full efforts to carry out inoculations. However, we have seen a large and rapid spread of fake news that are promoting distrust in the vaccines. For instance, people also say that if one opposes to get vaccinated, he or she would get arrested. And also, as for the AstraZeneca vaccines, the efficacy rate for the senior citizens above the age of 65, it hovers only around 8%, which is a false information. And to these fake news and rumors, we will be making sure that these people that spread such rumors will be faced with stern legal measures. And we will also cooperate with the police agency as well as other government institutions as well. And we will make sure that we looked at the Fact Check Network, which is the civil society platform. And we will also make sure that all of these information distributed to the public are true and also facts. And starting from today, the Korea Communications Commission will also verify the information if a citizen or a member of the public releases and spreads such information about these vaccines. And with such efforts, we will make sure that the public can receive only accurate information based on scientific evidence. And as for the safety e-reports of COVID-19, in July, we also launched such a platform, and until now, we have had about 120,000 reports. Of them, 40,000 were related to not wearing face masks, and also we have identified 38,000 to be related to breach on the gathering ban. And also, we have seen many reports that have been reported on the breaches of these quarantine measures. And in response, the government also is making sure that these reports are justified and also are corrected going forward. And we will make sure that we also spread and we make use of such a system going forward as well. And we ask for your participation going forward as well. And it is very important that you are exerting your full efforts as the individual citizens of this country, also exerting a sense of responsibility. We thank you once again. The government will also exert its full efforts. And as for the quarantine officials, we have a special childcare services that we are also rolling out to these members. And as for these quarantine officials, many of them have to work long hours, and they were going through difficulties in childcare and child rearing. So to this end, the government is providing 24-hour services for these young children, and these are applied to all of the quarantine officials and epidemiological investigators who have children under the age of 17, and also they will be able to apply through hotlines and also through the 누리집 database. So we would like to once again thank the medical staff members as well as the quarantine officials for their continued efforts. Today, we have seen a 400 range of the new COVID-19 cases. We are seeing a stall in the number of daily caseload. However, we still have many risks of possible resurgence of the virus. With the warmer weather, we have also the risk of increased foot traffic. During last weekend, we also have seen that the foot movement of the public has rose about 12.7% on week, and this is similar to that of last November's. And during the past week, we identified that more than 75% of the total cases were clustered in the capital area, and also we have seen that in the capital area, foot traffic increased by 9.4% on week during last weekend. And to this end, we ask for the residents of the capital area to also comply with quarantine measures stringently and also avoid having social gatherings and social meetings. Starting from yesterday, we also kicked off our new school year for many of our schoolers nationwide. And it is very grateful that our children are returning back to school. However, this requires the participation of the local community in curbing the further spread of the virus. We ask for the members of the faculty as well as students and parents to comply stringently with the quarantine measures, including washing of their hands and also ventilation and disinfection of the school campuses. And if you have any symptoms, please do not go to school and get tested as soon as possible. From last Friday until yesterday, we also have been continuing to inoculate our citizens with the COVID-19 vaccines, and a total of 87,428 people have been administered with their first dose of COVID-19 vaccine, which is essential in reaching herd immunity. However, in order to complete the inoculation drive and to reach herd immunity here in Korea, we will take a considerable amount of time. And until that day, we ask the members of the public to continue to comply stringently with quarantine measures. And until the day when we can return to a state of normalcy, the government will also make its best efforts. Thank you very much.
브리핑하신 분은 윤태호 중앙사고수습본부 방역총괄반장님이셨습니다.
That was a government briefing on the COVID-19 situation here in the country. South Korea reported 444 new cases of COVID-19 on Wednesday. This brings the accumulated number of COVID cases to 90,816. There have been 6 more deaths, raising the death toll to 1,612. We'll wrap up the coverage here and we'll be back at 12 p.m. Korea time with our midday news with Mark Broom. Bye for now.